First thing we're going to do is put this rubber band on. And it's going to act as a tourniquet so that it doesn't bleed.
Okay.
So we're going to take the gauze, and what we're going to do is we're going to squeeze the blood out of the toe. So that the blood gets squeezed out of the toe and goes up. Then we'll just use this rubber band, make it pretty tight, so that we have minimal to no bleeding during this little procedure.
Sounds good.
Step one. Now this is the ingrown nail. It's a little bit infected, it's red, you can see the skin is coming up, there's a little bit of blood coming out the tip. That's an infected ingrown nail. I've seen worse. This one's right there. We're going to use an acid, which is really actually a base, to kill the root of the nail. And we'll get there in a minute. But for the moment, we're going to do the mechanical part of actually removing the nail. Actually, just removing the side of the nail. And this is a scalpel. I'll show you that in a second. So now that we have used the tourniquet and we have exsanguinated, that means shove the blood out of the area, we're going to use this instrument called a spatula, kind of like the same one you use to flip eggs and pancakes. It's flat. And we're going to free up the skin and the cuticle from the top of the nail. And it shouldn't hurt because you've already been anesthetized. Boom. Right in. Doesn't hurt, does it?
No. Small bits of pressure only.
Yeah, you feel pressure with anesthesia, but you shouldn't feel pain.
Okay.
Next, we use the same spatula and we go underneath the nail to free up the nail from the skin under the nail. Done. Next, we use this instrument, and this is called a scalpel. There's a lot of different kinds of scalpels. This is one that we use for nails. And we are going to very carefully cut that side of the nail that is ingrown. Notice how there's so minimal amount of bleeding going on. Well, there is some. Next, we're actually now going to remove that piece of nail.
All right.
And this is the exciting part. I grasp it and remove it. That's what was in there. All that was underneath the skin.
You want to put that right here so we can get a shot
I'm
of
going
it?
to put it right there. So you can see that pretty good. Next, we take this instrument. This is called a curette. It's like a little scoop. It's a little sharp. And I just make sure that I didn't leave anything in there. No debris, no piece of nail, no anything like that. And I didn't, because I don't feel it. Next, we're going to do the fun part, which is to apply the acid.
All right.
So this is called sodium hydroxide. And this will actually destroy the cells of the root of the nail, and that's where the nail grows. It's kind of like a plant or a tree. Nails grow from a root. That root is here below the cuticle. So if we apply this acid to that root, that part of the nail is not going to grow. It's really as simple as that. So we do it carefully. It's an acid. We don't want to spill it anywhere. And here we go. We put it in for a few seconds. You don't need a whole lot. That's number one. We do it twice. Number two. And any little spillage that goes on, we wipe off. So we don't burn any of the surrounding skin or anything. What, it stopped?
Mine did, but hers is still going.
Okay. Finally, you ready? Finally, we use this, and this is called acetic acid, which is much more commonly known as vinegar, because that neutralizes the sodium hydroxide. That being done, we'll once again use that curette. Make sure I didn't leave any little pieces of cotton from that applicator in there or anything like that. And we're going to use this. It's called Silvadene cream. And this is a cream that's often used for burns and stuff like that. It's really good. But in reality, we're using it more or less so that the bandage doesn't stick when you take it off tonight or tomorrow morning. And now we get to the end, and we put on the bandage, and we put it on with a little compression. Stop any bleeding that's going to occur when I take off the tourniquet, the rubber band. We wrap it up nice. It's kind of a little bit of an art form to wrap a toe.
Mm-hmm.
But after all these years, I think I've gotten it down pretty good. Take off our gloves. Cut this. We cut this. We put this on like a little cover. It's also gives some more compression. And of course it looks good. Of course you want to remove this rubber band so that you can have some blood flow to your toe. It doesn't fall off later, and we're done.
Excellent.
Good job.
Well, give it a like.
Good job. Oh, even blood on my finger. Good job.